back to Great Day Houston. We are in the world's largest medical center where 10 million patients come every year. Now, a lot of patients will delay getting treatment because they're afraid of what that treatment will look like. It can be pretty aggressive at times. Take, for example, fibroids. It used to be you had a hysterectomy or just suffered through it. Well, today, things have changed. Welcome back, Dr. Andrew Doe, interventional radiologist and founder of Alate Health, along with Alate Hart. She was treated for uterine fibroids. All right, first of all, what are they?
So uterine fibroids they're tumors in the uterus. They're benign. They're not going to spread and take over like a cancer would, but they can enlarge the uterus and cause all types of symptoms.
Yeah, speaking of all types of symptoms, when did you first notice something was kind of crazy with you and then things just got pretty bad where you at one point became anemic?
Yes, I became anemic. I noticed it happened when I was at work. I was getting weak and
was during your cycle, things would just go crazy.
Yes, it was going crazy and I was bleeding heavily. That's how I noticed it, and I just couldn't do a lot of things. My energy was really, really low. I couldn't really do much, and I went to the doctor and they were saying that I was anemic and that I needed blood transfusion and all this other stuff. And I was like, okay. Then they, diagnosed me and said that I had fibroids.
Yeah, because that's the important part, doctor,
Right.
is to know why something is happening.
Yes.
So the initial thing was you're anemic, but we had to figure out why.
What was causing that? Mm-hmm.
Yeah. All right, so they treated the anemia part, but now comes the issue with the fibroids, and there are different ways that you can treat it. I mentioned earlier how a lot of women thought the only recourse was to get a hysterectomy, and back in the day, that's kind of what we did.
Yeah, before we had a lot of hormonal therapies and things like that. Now something as simple as birth control can kind of temper the symptoms and lighten the cycles. But the definitive treatment was only hysterectomy.
Yeah. What causes them? Could it be a hormonal imbalance at times?
So we know that estrogen causes them to grow. We don't know why they start to grow. We do see some genetic link between families that will have fibroids. We also know that African American females have a much higher incidence of fibroids, as well as Latino females. Mm-hmm. We know there's a link between several different things. Things as common as being overweight, and then things kind of as strange, you may think, as some hair chemicals can cause these fibroids to grow.
Wow. All right. So knowing that a hysterectomy could probably solve your problem, you were hesitant to do something like that.
Yes, I mean, I went to 2 different doctors and they both said the same thing, and I was like, no. This can't be. I'm too young for this.
Yeah. You want to keep your body parts.
Right.
All right. So that's kind of a different way of looking at it. But today we have another option, and that is the non-surgical alternative uterine fibroid embolization. So explain what that process is and how it can help treat the problem.
So basically, we take advantage of the fact that these fibroids grow their own blood supply and increase their own blood flow to them. And what we do is we go into the arteries that feed them and we plug those up and basically cause the fibroid to die, and it will over time shrink down. And the uterus will remain intact, and you don't need a hysterectomy.
Who qualifies for that, or who would be a good patient for that?
So the ideal patient is someone who is done having children, but is still dealing with heavy periods, long bleeding, greater than 5 or 7 days, changing pads or tampons every hour or 2 hours, things like that. I also have a lot of patients who have what we call bulk symptoms, or pressure, feeling like they're pregnant, having to urinate all the time.
Yeah.
So
I have friends who had the full-on hysterectomy. They were down and out for a while, and so I would imagine with something like this, because you're not really going in there doing that major surgery, is that the downtime is not bad. So what was the downtime like for you?
The downtime.
You went shopping after you were done, didn't you?
Oh, yes, I did. Right after that, the procedure and stuff, I went to work.
You went back to work after the procedure?
Yeah, because I did it that Friday, and that Monday I went right back to work.
Yeah.
So it was great because you take the surgery and you out the same day.
Right. So that way you have really no downtime, less invasive,
Yes.
less expensive, all that type of stuff, no scarring, no hospitalization.
No.
Right.
And most that we've come to find out in my office that Thursday is always the most popular day because you can have that Friday, Saturday, Sunday and be back to work on Monday.
Now, if someone doesn't treat those fibroids, besides being miserable, can it do things like impact fertility and things like that as well?
Yes, it can impact fertility, and that's one of the areas where we take time with our patients because there's mixed evidence out there of uterine fibroid embolization in the population that still wants to get pregnant. Sometimes it's not the best option.
Yeah, and another thing that you were happy about is that it's always great to have a good relationship with your doctor.
Yes,
You say you
yes.
love this man.
Yeah, I love this man.
What was it about him that was different than
Well,
others?
he made me feel comfortable, and he really saved me because I'm like, I thought hysterectomy was the only option for me, and he made me realize, okay, you know, not so many women know about this, and I didn't. I was clueless about this. I didn't even know this exists. So he really, really brought, you know, saved my life, and I'm good. I'm not having heavy bleeding, and I'm feeling great.
All right, I want to wrap up with thank you very much for your service. He's one of the folks who, after 9/11, you joined the Army
Yes.
and went to Iraq.
Yes.
But as an MMA fighter you were before?
Former.
Yeah,
Long
before.
time ago.
You're just kind of one of those guys that finds an adventure, don't you? All right, I want to let you know that Alate Health, you can get in touch with them if you're interested in doing this for the relief of fibroids for you. Alate Health, 713-588-5050, 713-588-5050 for more information or to make an appointment, and BeFibroidFree.com. BeFibroidFree.com is the website. Thank you very much.
Thank you.